Modern Dental Assisting, Chapter 51, Provisional Coverage. We're going to talk in this chapter about temporary or provisional restorations. Temporary protective crown or bridge that is temporarily cemented to a tooth and has been prepared to receive a single crown or the abutment teeth of a fixed bridge. The temporary is going to restore and maintain function, and it's also going to keep the patient comfortable while they're waiting for their permanent restoration. Indications that we might need a provisional crown or coverage. We want to protect the pulp from sensitivity, maintain good periodontal health. This will provide occlusal stability, maintain tooth position within the arch. This will protect the margins and the preparation from fracture. This will be color compatible with adjacent teeth, and it's also going to help the patient to chew and function in this area. Categories of provisional coverage include the custom provisional. This is a little bit more time consuming, but it is the best fitting and the most natural looking for our patient. We also have prefabricated options. These are shell-like crowns. We use these for single unit teeth. They can come in a variety of materials, including polycarbonate, cellulose, aluminum, tin, stainless steel, and then also laboratory fabricated. The criteria for provisional fabrication include provisional coverage should be aesthetically acceptable. The contour should be similar to natural teeth. The cervical margin should be smooth and then also fit snugly. The coverage does not extend below the margin of the preparation. Occlusal surface is aligned with the occlusal plane of the adjacent teeth. When temporarily cemented, the provisional coverage remains stable and it should stay in place, and it also should be comfortable for the patient. The provisional coverage can be easily removed without damage to the tooth or any of the adjacent tissues. The provisional method includes a tray or mold that's been prepared for use before the dentist prepares the teeth for a final impression. Common types of molds that we may use to hold the provisional material when making the coverage include our alginate impressions, baseplate wax impressions, vacuum formed trays, and silicone putty impressions. Our provisional material can be divided based on their makeup, supply, and setting properties. These include powder and liquid materials, paste and paste materials, and then also light polymerized materials. For our preformed crown method, you'll use a fabricated provisional shell-like crown size. It's going to be specific for each tooth. The preformed polymer crown resin used in this technique is kind of a hybrid composite resin and monomer mixture, and it has a setting time of 90 seconds. These are tooth colored, and they're used on anterior teeth in cases which appearance is important. The selected cement should provide adequate strength to retain the temporary restoration for function. We have options of ZOE, zinc oxide eugenol, polycarboxylate, and resin temporary luting. If we're seeing occlusal errors or voids, we can trim away any interproximal tags before filling and reseating the impression. If a provisional restoration is locked on, we're going to want to try to remove the material while it's still soft. If we have any marginal discrepancies, we want to reline with more material and then reseat. And for removal, we want to apply temporary cement around the inner aspect of the margin. So we talk a lot about post-op instructions. We want to provide these to our patients verbally and then also in writing for them to take home. And they should include to bite and chew carefully. And we want them to avoid any hard, sticky, or crunchy food. When our patient is flossing around the provisional, we don't want them to pop the floss in and out of contact. We want them to place the floss in the interproximal and then pull through the lingual or facial side. And also, if the provisional coverage becomes loose or lost, they should contact the office immediately to have it replaced. It's essential that a provisional crown or bridge remains cemented while the fixed prosthesis is being prepared and delivered to the dental office. When the patient returns for the final cementation of the fixed bridge or crown, the provisional should be cautiously removed without causing any fracture or harm, just in case it needs to be re-cemented if that final prosthesis needs to be sent back to the lab.